Hello and a warm welcome to everyone. I am Dr. Caroline Bennett. Today, we need to have a very serious conversation. It is one of those discussions that could literally save your life, or at the very least, radically alter the trajectory of your health management. In our daily lives, we obsess over our faces. We scrutinize our skin for wrinkles, we monitor our hair for graying, and we spend significant resources on anti-aging creams and treatments. But there is a small, often overlooked part of our anatomy, frequently hidden under layers of acrylic, gel, or colorful polish, that we tend to ignore completely until it breaks, peels, or looks unsightly. I am talking, of course, about your fingernails. As a physician dedicated to longevity and preventive diagnostics, I am going to share a fundamental truth that we teach medical students in their very first year of physical diagnosis. Your nails are not merely aesthetic accessories. They are not just claws for scratching or opening cans. They are biological windows. They are translucent portals that allow us to look directly into the internal environment of your body. They give us a real-time report on the quality of your blood, the efficiency of your metabolism, the status of your nutritional reserves, and the functional health of your vital organs. An experienced oncologist, endocrinologist, or cardiologist can often intuit a complex diagnosis simply by shaking your hand and glancing at your fingers. Your nails record the history of your health over the last 6 months. Every nutritional deficiency, every episode of intense physiological stress, every major hormonal imbalance, and in rarer but critical cases, the presence of systemic diseases like cancer or organ failure leaves an indelible physical mark on the nail plate. Today, I want to teach you how to read these signals. I want you to look at your hands right now, not with the critical eye of a beauty consumer worrying about a chipped manicure, but with the analytical eye of a clinician asking, "What is my body trying to tell me?" We are going to analyze the texture, the shape, and the color of your nails to decode the urgent messages your biology is sending. To understand why the nails are such accurate indicators, we must first understand their anatomy and physiology. The nail plate, the hard part you paint, is dead keratin. However, it is born from the matrix, a specialized tissue hidden deep beneath the cuticle and the proximal nail fold. The matrix is one of the most metabolically active tissues in the human body. It requires a constant rich supply of oxygen, amino acids, vitamins, and minerals to produce healthy nail cells. Here is the crucial point. The body is an intelligent survival machine. If your body enters a state of crisis, whether due to malnutrition, severe illness, or chronic stress, it engages a biological triage. It immediately cuts off the supply of resources to the non-essential peripheries, like your nails and hair, to preserve those nutrients for the heart, the brain, and the lungs. Therefore, the nails are often the first place to show signs of systemic trouble, and the last place to recover. 1. Texture analysis. When the surface speaks, hold your hand up to the light. Angle it so you can see the surface sheen. Is it smooth and glassy, or does it look like rough terrain? Vertical ridges, onychorhexis. The first sign many people notice, especially after age 50, is the appearance of vertical ridges running from the cuticle to the free edge. They look like candle wax drippings. Many patients rush to my office terrified, convinced they have a severe vitamin deficiency. Here is the reality. If these lines are fine, regular, and present on all nails, they are often simply the nail's equivalent of wrinkles. They represent the physiological aging of the matrix, which, like our hair follicles, becomes less efficient at producing perfectly smooth keratin over time. However, we must look closer. If these ridges are deep, pronounced, and accompanied by extreme brittleness, where the nail splits down the ridge, this is no longer just aging. This trachyonychia can indicate a severe deficiency in B-complex vitamins, specifically B12, or a lack of magnesium. It is also a hallmark sign of systemic dryness caused by hypothyroidism, or a drop in estrogen during menopause. Bose lines, the biological stop sign. Much more concerning are Bose lines. These are horizontal depressions, deep grooves or trenches that run across the nail from left to right. This is not a nutritional issue. This is a medical history marker. A Bose line indicates that at a specific moment in the past, your nail matrix suffered a cardiac arrest of sorts. It stopped producing cells entirely to save energy because the body was fighting a major battle. We see this after high fevers, severe infections like pneumonia or severe COVID-19, a heart attack, a cycle of chemotherapy, or even a devastating emotional shock like the loss of a loved one. Because fingernails grow at an average rate of 1 millimeter every 10 days, or 3 millimeters a month, we can use these lines to date the trauma. If the groove is in the middle of your nail, the event happened roughly 2 to 3 months ago. If you see these lines across multiple nails, you must ask yourself, what happened to my health 3 months ago? Pitting the thimble sign. If the surface of your nail looks like it has been pricked by a needle, showing tiny random dents or ice pick holes, this is called pitting. This is almost exclusively a sign of autoimmune disease. It is the classic sign of psoriasis, even if you don't have skin plaques yet, or psoriatic arthritis. It can also appear in alopecia areata and Reiter's syndrome. The body's immune system is attacking the nail matrix, causing cells to slough off in patches. 2. Shape analysis. The geometry of pathology. The physical curvature of your nail can change drastically in response to blood oxygen levels and iron stores. Koilonychia, spoon nails. Let's talk about a condition called koilonychia. In this state, the nail becomes so thin, soft, and concave that if you were to place a drop of water in the center of the nail bed, it would not roll off. It would sit there as if in a spoon. This is the classic textbook sign of severe iron deficiency anemia. The nail matrix lacks the iron required to form the rigid enzymes that harden the keratin. Consequently, the nail collapses in the center. Paradoxically, this can also be a sign of hemochromatosis, a condition where the body absorbs too much iron. If you have spoon nails coupled with fatigue, pallor, or shortness of breath, a blood test for ferritin and iron binding capacity is mandatory and urgent. Digital clubbing, Hippocratic fingers. On the complete opposite end of the spectrum, we have clubbing. This is a red alert medical sign first described by Hippocrates thousands of years ago. In clubbing, the soft tissue beneath the nail bed swells, causing the nail to broaden and curve downward excessively, resembling the back of a spoon or the glass of an antique watch. The fingertips themselves enlarge, looking like drumsticks. Clubbing is almost always a sign of chronic, long-term low oxygen in the blood, hypoxia. The body tries to compensate by dilating the vessels in the fingertips, which releases growth factors that cause the tissue to swell. We see this in patients with lung cancer, cystic fibrosis, pulmonary fibrosis, and congenital heart defects. If you notice your nails curving downward and your fingertips getting bulbous, perform the Shamroth's window test. Put your 2 index fingers together, nail to nail. You should see a tiny diamond-shaped gap of light between them. If there is no gap, you have clubbing. You must see a doctor immediately for a chest X-ray. 3. Color analysis. The spectrum of internal health. A healthy nail should be pink. This pinkness comes from the rich vascular bed underneath. When the color changes, your internal organs are speaking to you. Pale or white nails, Terry's nails. We all know about the occasional white spot from banging our finger. But if the entire nail turns opaque white, looking like ground glass, with only a thin pink or brown band at the tip, we are looking at Terry's nails. This is a highly specific sign of liver failure. The liver is not producing enough albumin, which changes the osmotic pressure of the blood, and alters the connection between the nail plate and the bed. Terry's nails are frequently seen in liver cirrhosis, but also in uncontrolled type 2 diabetes, congestive heart failure, and severe malnutrition. Half and half nails, Lindsay's nails. If the half of the nail near the cuticle is white, and the distal half, near the tip, is dark pink, red, or brown, these are Lindsay's nails. This is a specific alarm bell for the kidneys. It is a strong indicator of chronic renal failure or uremia. The kidneys are failing to filter nitrogenous waste products, which accumulate and alter the pigmentation of the nail bed. Patients on dialysis very often exhibit this sign. Yellow nail syndrome. Yellow nail syndrome is a rare but serious medical entity. The nails become thick, yellow-green, the cuticle disappears, and growth arrests almost completely. This is not just a fungus. It is often linked to the lymphatic system, lymphedema, pleural effusions, fluid around the lungs, or chronic respiratory diseases like bronchiectasis. However, in everyday practice, the most common cause of yellow nails is onychomycosis, fungal infection, or simply staining from leaving dark nail polish on too long without a base coat. But here is the differentiator. If it is a fungus, the nail usually lifts and crumbles. If it is yellow nail syndrome, it remains hard and intact but stops growing. If your nails are yellow and you have a chronic cough, look to your lungs. Blue nails, cyanosis. If the nail bed turns blue, purple, or slate gray, this is cyanosis. It means there is not enough oxygen in your red blood cells. This is an emergency sign of acute respiratory distress, severe asthma, or emphysema. Alternatively, a slate blue color can indicate Wilson's disease, copper accumulation, or silver poisoning argyria. 4. The Oncology Alert, melanonicia. Here, I must pause to give you the most critical warning of all, the Oncology Alert. If you see a new vertical dark stripe, black, brown, or gray, running the length of the nail from the cuticle to the free edge, you must pay maximum attention. In people with darker skin tones, African, Asian, Hispanic, longitudinal melanonicia can be a normal physiological variant, like a freckle. However, if you have fair skin, or if this stripe appears suddenly on a single digit, often the thumb or big toe, this is a red flag. We use the ABCDEF rule for nails. A. H. Peak incidence is 50 to 70 years old. B. Brown/black is the band dark and wide, more than 3 millimeters. C. Change is the band changing, getting wider or darker. D. Digit is it on the thumb or big toe. E. Extension. This is the most critical sign, called Hutchinson's sign. Does the pigment extend beyond the nail and onto the skin of the cuticle or the nail fold? If the skin around the nail is turning black, this is highly suggestive of subungual melanoma, an aggressive form of skin cancer. F. Family history. Do you have a history of melanoma? Do not mistake this for a bruise, subungual hematoma. A bruise will grow out with the nail over time. A melanoma starts at the matrix and stays there, feeding a continuous line of pigment. If you have a dark stripe that doesn't move, see a dermatologist for a dermoscopy immediately. 5. Brittleness and the thyroid connection. Dr. Bennett, my nails peel, they break, they are soft like paper, they never grow. This is the #1 complaint I hear in my clinic. While this can be due to water exposure, persistent brittle nails, onychoschizia, are often the first silent whisper of thyroid dysfunction. In hypothyroidism, slow thyroid, the metabolism drops, peripheral circulation decreases, and the matrix does not receive enough nutrients or warmth. Nails become dry, brittle, ridged, and grow painfully slowly. Often they also lift off the nail bed on onycholysis. In hyperthyroidism, fast thyroid, nails can become soft, thin, and concave, plumber's nails. If you have brittle nails paired with hair loss, especially the outer third of the eyebrows, dry skin, fatigue, cold intolerance, or unexplained weight changes, stop buying hardening polishes containing formaldehyde and ask your doctor for a full thyroid panel, TSH, free T3, free T4, and antibodies. 6. The truth about supplements, biotin and beyond. Many of you take hair, skin, and nails supplements. But do they work, or is it expensive urine? Biotin, vitamin B7, is the most famous. The science shows that biotin does work to thicken the nail plate by about 25%, but only if you have a brittle nail pathology or a deficiency. Taking megadoses if you are healthy won't turn your nails into steel claws. But biotin is not the only player. Nails are made of keratin, which is a protein. Protein intake. If you are eating a low-protein diet, common in women over 50 who lose their appetite for meat, your body will not have the amino acids, cysteine and methionine, to build keratin. Zinc. White spots that recur are often a sign of subclinical zinc deficiency. Zinc is crucial for protein synthesis. Silicon. This trace mineral acts as the structural glue for keratin. Choline-stabilized orthosilicic acid is a validated supplement for nail strength. Iron, as mentioned, vital for oxygen transport to the matrix. Dr. Bennett's Nail Health Protocol. So, what should you do to maintain nail health and use them as a diagnostic tool? Here is my prescriptive protocol. The naked nail rule. At least once a week or every time you change your polish, remove all coverings and inspect your naked nails under bright natural light. Look for changes in color, shape, or texture. If you see something new, take a photo to monitor its evolution over a month. Matrix hydration. Remember, the nail plate is dead, but the matrix is alive. Applying oil to the hard nail does very little. You must apply a high-quality lipid oil, like jojoba, which mimics human sebum, or castor oil, to the cuticle and the skin at the base of the nail. Massage it vigorously every night. This stimulates blood flow and feeds the factory where the nail is made. Physical protection. Water is the #1 enemy of brittle nails. The nail is porous. It absorbs water, swells up, then dries out and contracts. This continuous cycle of expansion and contraction breaks the keratin bonds, causing peeling at the tips. Always, without exception, wear cotton-lined rubber gloves when washing dishes or cleaning. Detergents are lipid solvents. They strip the natural glue that holds your nail layers together. Smart supplementation. If you have ruled out systemic disease with your doctor, a 3 to 6 month cycle of biotin, 2.5 to 5 milligrams, organic silicon and collagen peptides can help restore structural integrity. Respect the cuticle. Never cut your cuticles deeply. The cuticle is the biological safety seal that prevents bacteria and fungus from entering the matrix. If you break this seal, you invite chronic inflammation, paronychia, which will permanently deform the nail growing out. Gently push them back, but do not excise them. In conclusion, your nails are loyal little messengers. They are constantly trying to warn you when something is wrong inside your fortress. Do not shoot the messenger by covering them perpetually with acrylics or ignoring their changes. A healthy nail is smooth, pink, slightly convex, flexible yet strong. Any persistent deviation from this standard deserves investigation, not just by your manicurist, but by your physician. True health is revealed in the details. Take care of your hands, for they tell your biological story more honestly than you might realize. If you found this deep dive into diagnostic medicine valuable, and you want to continue learning how to decipher the secret language of your body, please leave a like and subscribe to the channel. I want to hear from you in the comments. Have you noticed any of these signs on your nails? Do you have ridges, spots, or stripes? Let's discuss it together. I am Dr. Caroline Bennett. Your health is my mission. I will see you in the next video.